Hi everybody, Dr. Britt Talley Daniel MD. I'm a neurologist aesthetic doctor, and I have other posts and videos on my YouTube channel you could look at. I would really appreciate it if you would subscribe to the channel so we can follow each other and see what I'm saying about migraine. I've also written a large book on migraine and a smaller book on migraine. They're both in print, ebook versions, and you can find them by going to Amazon and listing my name and clicking there to get involved with that. Today, I'm talking about a neat thing your doctor can do in the office to help you acutely for migraine treatment. And the question is, do occipital nerve blocks work for migraine? Well, migraine really is a trigeminal neurovascular problem, so it involves the arteries in the brain that dilate during the headache, and they do that in response to chemicals that cause that. And also, it involves the trigeminal nerve, which supplies the face. It supplies the forehead, the cheek area, and the jaw area. But in the nucleus caudalis, the brainstem, there are fibers there that are turned on by migraine that go to the back of the head in the C2, which is the occipital nerve distribution. It's usually on one side. So you can give an injection back there, and that seems to help for migraine. So the question is, do occipital nerve blocks help migraine? Question? Yes. There are many neurologic articles written about this in the literature. There's a great amount of just clinical neurologic experience saying that injection with a needle in the back of the head on one side in the occipital nerve area will help. And usually the shots are given with cortisone in it, or with cortisone and lidocaine, or lidocaine alone. They're kind of like a dental injection in your jaw, where the dentist gives you a shot back in the back of your tooth back there and blocks your jaw and your face gets numb. So where is the injection given? Well, it's given in the back of your head, halfway between the very center of the back of your head and your ears, about halfway up. And the doctor uses a small needle, which is a 26 or 27 gauge needle, and has a 1 cc syringe, and usually gives a little shot of the lidocaine, which is the painkiller, first, make the area dead, sort of. You won't feel it, just like a dentist gives you a shot and your face gets numb. And then the doctor goes in and gives you the full shot of 1 cc, usually of cortisone or a local anesthetic, which would be Bicaine or Novocaine or lidocaine. Well, what about patients that are allergic to cortisone? So the doctor should always ask the patient, are you allergic to cortisone injections? And if they are, you should not give the shot. That's a contraindication. Where is this done in the doctor's office? Is it a special deal? You have to go to the ER or something like that? No. It's done in a little treatment room or just the doctor's examining room. Simple cortisone and lidocaine injection back to the head. It's not a big deal. How long does this take to do this procedure? Well, to give the local anesthetic, doctor usually gives that first and waits about 4 or 5 minutes till local anesthetic starts to work. So then when he injects the needle with all the medicine in there, it doesn't hurt as much. Although it doesn't hurt that much anyway. How long does the procedure take? Well, this is a simple, quick outpatient procedure, much like getting an injection in your jaw for dental work. It just takes a few minutes, actually. How long before I could resume my normal activity after an injection like this? Well, you don't have to be observed in the doctor's office. You can get up and go home, and you can drive a car and resume normal activities after the procedure's done. How long does it take for the treatment to work? Well, sometimes you get treatment results within 15 or 20 minutes. Sometimes it takes days to weeks. But what are the results of this? Well, one recent study found that 80% of patients who were given a shot of either lidocaine or local anesthetic or cortisone injection like Medrol had either moderate or significant decrease in pain, which can work again for days, weeks, or sometimes it'll work for a month or so period. Occasionally patients are given a second injection if they were successful with the first. That's usually done a week later. How long do the effects of the nerve blocks last? Well, I've already said that they can last up to several months. It's usually days, weeks, or something like that. But the point is, in the office, the doctor can give you a shot and give you immediate relief or something. You go home, the headache's been very severe, it will get better and effectively usually in that time frame. It really helps that. What are the side effects of occipital nerve injection? Well, most common side effects, and it hurts a little bit. Other side effects include temporary 6 to 8 hour symptoms of bleeding at the local site, which is very rare, dizziness, weakness, numbness, and lightheadedness, period. Usually you don't have any blood loss. The doctor doesn't have to put a dressing or a Band-Aid on this. It's normal to have numbness at the site of the needle injection back ahead that may last 3 or 4 hours, again, just like dental anesthesia. Okay, well, that's the end of my notes on this for today. Good luck with you all. Hope it helped you. Good luck with seeing your doctor with these problems. Bye-bye.